Non-rapid eye movement sleep arousal disorders represent a fascinating yet concerning category of sleep disturbances that profoundly impact individuals and their families. These disorders, commonly known as parasomnias, occur during the deeper stages of sleep when the brain typically experiences its most restorative phases. Unlike dreams that occur during rapid eye movement sleep, NREM sleep arousal disorders manifest during slow-wave sleep, creating a unique state where the person appears partially awake while remaining fundamentally unconscious. The spectrum of NREM sleep arousal disorders encompasses several distinct conditions, with sleepwalking being the most widely recognized manifestation. During sleepwalking episodes, individuals may perform complex behaviors ranging from simple sitting up in bed to elaborate activities like cooking, driving, or even leaving their homes entirely. These episodes typically occur during the first third of the night when deep sleep predominates, leaving sufferers with little to no memory of their nocturnal adventures. The behaviors exhibited can be surprisingly sophisticated, as sleepwalkers often navigate familiar environments with apparent ease, opening doors, climbing stairs, and avoiding obstacles despite their altered state of consciousness. Sleep terrors constitute another significant category within NREM sleep arousal disorders, particularly affecting children between ages 3 and 12. These episodes begin with sudden, intense screaming or crying, accompanied by signs of extreme fear and autonomic arousal, including rapid heartbeat, sweating, and heavy breathing. Unlike nightmares, sleep terrors occur during deep sleep rather than dream sleep, making it nearly impossible to console or fully awaken the affected individual. Parents often describe feeling helpless, as their child appears terrified yet remains unresponsive to comfort attempts, creating significant distress for the entire household. Confusional arousals represent a third major category, characterized by disorientation and confusion upon awakening from deep sleep. Individuals experiencing confusional arousals may appear awake but demonstrate slow speech, confused thinking, and inappropriate responses to questions or situations. These episodes can last from minutes to hours, during which the person may perform routine activities while remaining fundamentally confused about their surroundings, time, or circumstances. The distinction between confusional arousals and normal grogginess lies in the severity and duration of the disorientation, which extends far beyond typical sleep inertia. The underlying mechanisms driving NREM sleep arousal disorders involve complex interactions between sleep regulation systems and arousal mechanisms within the brain. Research suggests that these conditions result from incomplete transitions between sleep stages, where parts of the brain responsible for movement and basic behaviors become active while areas governing consciousness and memory formation remain dormant. Genetic factors play a significant role, as these disorders often run in families, suggesting hereditary predisposition to unstable sleep-wake transitions. Environmental and lifestyle factors significantly influence the frequency and severity of NREM sleep arousal disorders. Sleep deprivation serves as a primary trigger, as exhausted individuals spend more time in deep sleep, increasing vulnerability to arousal disorders. Stress, both physical and emotional, can destabilize normal sleep architecture and precipitate episodes. Irregular sleep schedules, shift work, and frequent time zone changes disrupt natural circadian rhythms, creating conditions favorable to parasomniac episodes. Additionally, certain medications, particularly those affecting the central nervous system, can increase susceptibility to these disorders. Medical conditions frequently coexist with NREM sleep arousal disorders, creating complex diagnostic and treatment challenges. Sleep-disordered breathing, including sleep apnea, can fragment sleep and trigger arousal episodes. Restless leg syndrome and periodic limb movement disorder may similarly disrupt sleep continuity. Fever in children often precipitates sleep terrors, while neurological conditions such as epilepsy or brain injuries can increase parasomniac tendencies. Understanding these relationships proves crucial for developing effective treatment strategies. Diagnosis of NREM sleep arousal disorders requires comprehensive evaluation combining detailed sleep histories, physical examinations, and often overnight sleep studies. Polysomnography can capture episodes as they occur, revealing characteristic brain wave patterns and physiological changes during episodes. Video monitoring during sleep studies provides valuable insights into the nature and complexity of behaviors exhibited during episodes. Family members' observations prove invaluable, as they often witness episodes that patients cannot recall. Treatment approaches for NREM sleep arousal disorders emphasize both immediate safety measures and long-term management strategies. Environmental modifications form the foundation of treatment, focusing on creating safe sleep environments through removal of dangerous objects, securing windows and doors, and installing alarms or motion sensors. Stress reduction techniques, regular sleep schedules, and adequate sleep duration often significantly reduce episode frequency. For severe cases, medications such as benzodiazepines or antidepressants may be prescribed, though their use requires careful consideration of benefits versus potential side effects. The prognosis for NREM sleep arousal disorders varies considerably depending on age of onset, severity, and underlying factors. Childhood-onset disorders often resolve spontaneously during adolescence as sleep patterns mature and stabilize. Adult-onset cases may require more intensive intervention and have greater potential for persistence. However, with appropriate management, most individuals can achieve significant improvement in episode frequency and severity, allowing for better quality of life for both sufferers and their families. Understanding these complex disorders continues to evolve, offering hope for more effective treatments and improved outcomes for those affected by these mysterious nocturnal disturbances.